Thank you all for being here today. My name's Antoinette O'Connor, and I'm a doctor that works at Tallaght Hospital. And we're starting a research study called BioMinds, and it's called that because it means biomarkers in the identification of Alzheimer's disease in Down syndrome. And this research is about Alzheimer's disease and Down syndrome, and in particular, what we're trying to do is learn more about the early changes that happen in the brain as people age. And we hope that this work will help with earlier diagnosis, better care, and pave the way to better treatments in the future. Who can take part is anyone with Down syndrome who's over the age of 18. It's your choice, so um, you can say yes or no, or you can change your mind over time. Taking part involves a research visit, and during the research visit, there's a number of tests. These are the memory tests that Emer talked about earlier. They are like memory and thinking tests, like games. There's a health check, various things like blood pressure, and there is also a blood test. And with that blood test, we will also do some of those blood spot cards or finger prick blood tests to see if those tests are just as good as the routine blood tests. The whole visit usually takes around 3 hours, but there's loads of time for breaks, and you can bring a support person with you. The study really wants to focus on change over time. As Emer has shown, Alzheimer's disease is a condition that develops very slowly with very gradual change over many years. And sometimes those changes can be very hard to detect. And that's why it's useful to see people again and again to detect some of those slow changes. And some of the things so this study will ask you to come back, usually around once a year, although there may be other studies where we ask people to come back a little bit sooner if we want to see if blood tests stay the same. So one of the things we're really interested in is if you have a blood test one day, really the result should be the same if you have the test next week, and to make sure that that is actually the case. As you say, this work is a stepping stone towards the future. So research is sort of like going up a step of stairs, I often think, and you build on the work of the person before you. So for instance, the memory and thinking tests that are part of this study are the ones that Emer helped design in her study. And similarly, the blood spot test that she's helping validate now will hopefully be used throughout this study. So as we get those further steps, and this study helps to build another step on the stairs, the hope is that we're moving towards a new exciting time in Alzheimer's disease, where we not only have tests that help us with diagnosis, but also are moving towards an era where we may be able to, stop or ideally hope prevent this disease. But that is something that's really hard to do on your own because it's hard when knowledge is shared and learnings are shared, it's a lot more powerful. So we collaborate with lots of partners around the world. As Emer mentioned, we collaborate with universities in Gothenburg and Sweden, and also with multiple centres across Europe. We also are parts of efforts with the United States, and we're hoping by everyone working together, we'll be able to make steps towards really making a big difference in changing how the brain ages. So this is just to say that Ireland is part of a global effort with families and researchers across the world. And we really do think that sharing knowledge will help advance and improve brain health and achieve what we really want of preventing Alzheimer's disease. And I just want to talk a bit, I mentioned at the start that I'm a doctor, so I'm based at Tallaght and I work with the National Intellectual Disability Memory Clinic there. And that's a clinic particularly dedicated for people with intellectual disability and people with Down syndrome. And it does a number of things. It does memory and thinking checks, it helps with diagnosis, can provide advice on brain health and support after diagnosis. But one thing that we're really keen to build as part of this clinic is research opportunities, so that anyone coming to the clinic has an opportunity to participate in research if they want. However, if people don't want to participate in research, they can still be seen clinically. So, as Emer said, there's a lot of information in this presentation, and I just really now wanted to give a snapshot of what this study is and what it hopes to achieve and contribute to. But Really happy to take any questions or chat through in more detail. Or if anyone would like an information sheet that goes through the study in a little bit more, we can definitely provide those. Thank you. So I'm going to stop my share now if I can.